all the bony landmarks. So we're going to start with the kneecap, or the patella here. Then we're going to come down the sharpest point of the shin bone here, down to the distal end. And we're going to mark that. Then we're going to come out on the plateau here. So that's going to come out here, and you can almost feel the apex of that right there. And then what you're going to do is we're going to kind of increase this wherever we, like kind of the broad base of the bone. So in this instance, I'm going to start here, kind of bring that around, and I can feel the bone edge right here. So I'm going to keep this fairly tight, but bring that down and kind of broaden that anywhere I feel that broad base of the bone. And I'm going to do the same on this side. Come right through here, come down, and I can feel the distal aspect of the bone, so I'm going to really bring this mark around and capture that distal aspect. Okay? Then I'm going to mark the apex. You can see the apex of the fibula head there. So I'm going to mark that, and I'm going to do the same thing. Kind of palpate. I can feel that broad edge of the bone there. And even around towards the back. And down on the bottom here. And I'm going to go ahead and connect those. So essentially what I'll do is I'll relieve the apex, and then I'll taper it out. And then in this case, I can palpate the distal fibula. So I'm going to do that. I'm going to mark the distal aspect of that, and I'm going to do the same thing, kind of palpate around and open that, just so again, the center will have the highest peak of relief, and we'll feather that down. Then the last thing I'll do here is I will palpate the patella ledge, and I'm going to go ahead and mark that, just like that. Okay, and that's the patella tendon there.
Right.
I'll feel through here if there's any, like if the condyles are sharp, I may just kind of X those out. So if one was sharp here, you could put a little X right at the apex of it. Now, let's assume he had a history of a breakdown here. You want to try and keep that relief as tight as possible. So if he's got scar tissue, or if the area is still open, you want to come in and really localize it, really define where that area is that he needs the relief. And that tells us to increase the amount of relief there a little bit. Okay? Then we're going to put these in. We typically fold back the leading edge of the roll, because once it's wet, that double layer makes it easier to grab. So we're going to do that. Same here. And we're going to go ahead and let those get typically about 30 seconds. We let that saturate.
If it's hot there and the water's
It will
hot,
be hot, so it'll be less time.
it'll go up
Right,
fast,
this is
so-
cool. The other thing is he's sitting away from the chair so that the popliteal or the back of the knee isn't going to interfere here, and he's slightly flexed there. You want him slightly flexed and have him relax so that he's not engaging those muscles. Then we're going to take this, you're going to wring out most of the moisture, and we're going to start wrapping. I like to start at the top edge. So we're going to come down, and when you see the example cast, they'll know you want to cover at least half the patella, and you want to come in. You can cover it all, but you want to do it kind of this tapered way, coming down. Little higher in the back, and we're bringing it down, just like that.
And then the only other thing is, it's not like an ace bandage. You're not trying to compress them. You're just applying.
Just to get the wrinkles out. So now we're going to work down. And as you come down, sometimes it helps to grab the bottom edge and just kind of fold it, just so that it stays taut like that. And just bring this down. I'm going to come up a little. And just kind of smooth this first one in. Now the tricky part of this whole thing is the distal end. The best way to capture that, we're going to do the same thing, squeeze that out, is take the wraps, and this time you're going to work front to back. So I'm going to bring that back and come this way and just kind of do this, just to kind of get that coverage over the distal end. Down, up, And then I'm going to do one probably side to side just to get that last little bit. And then down here. And then I'm going to give this a good kind of rub in. That's perfect. And then the rest of it, what you're going to do now is wrap around those front to back pieces just to make sure that's all grouped together. And I'm just kind of going over everything using this last little wrap. I'm feeling for any weak points. If there are any, you're going to bring it down, kind of hit those. Just like that. And now that's all set. Kind of work that in a little bit. Good. Now comes hand positioning. I'm going to take my thumbs and I'm going to use my middle finger and my ring finger. And what I'm going to do is come in almost at a 90-degree angle with my thumbs, and that's on that patella tendon. So it's about a 1/4 inch below the distal aspect of the patella. And then in the back, there's going to be corresponding compression there in the back. What would you say, 1/2 inch lower? Maybe not even that much.
Well,
level.
yeah, it's probably level, only 1/2 inch.
Level. So you want your post, you know, the hands in the back to be level with the front.
Right.
Just and you can see that I'm lead, and here on your thumbs you want to use your thumb tips, not the fat pads of your thumbs, but your thumb tips.
You were saying to allow room for the hamstrings in the back.
That's right. So I'm not pinching them off on the hamstrings. I'm kind of coming at them like this. Okay, and then we want the back fingers kind of level with the front. And then we're just going to let that set up. And if you notice any gapping away, you can always take your index fingers and put slight compression there, but that's not as critical as this formation is.
She's going to give this to him, so you can bring this. But you can see what she's saying. She's actually created relief for the hamstring tendons by hitting them hard there. But you'll have this with you.
And
You
then
have this one.
and we'll give you this one, how to do it without pinching off the hamstring, so you have both. And I'm just applying gentle compression. We're defining that patella ledge because that's where the weight bearing area is going to be. And just kind of a corresponding, not real strong, not real tight. I'm not deforming any of the tissue.
And these are proprietary techniques, so if we start to see...
No.
They'll be replicated all throughout
If we
Africa.
start seeing people, well, we're worried about Salisbury.
Dr. Anderson book on how to measure BKA fatigues.
I don't think there is another company.
And then that's going to start. And this was cool water to start with. If it's warmer, that's going to trigger this a little quicker. But right before it sets up, what you're going to do is, with your fingers in place, you're going to ask the patient to go ahead and flex to about 45 degrees. So go ahead and flex as much as you're comfortable. And I've got my fingers in place. And now extend as much as you can. And all that does is it helps to define the posterior wall. It helps give us that flare. So it doesn't, it doesn't be
sit down
Makes a little
comfortably.
wrinkle in there.
right. Almost like
A flare.
a flare. And then when he sits too, it helps him to sit comfortably.
See it here.
Kind of
So
that.
then when he sits down, it's not cutting it.
It doesn't drive in.
Yeah.
And then what you're going to do is this should slip right off. So we're going to bring this here, ask him to relax. Sometimes you got to break the seal of it, but just
Let
kind
the
of
bag
keep your
come with
thumbs in place and just work that loose. And that comes straight off. And then we'll take the 1-5, we go ahead and remove it. It transfers all those indelible marks there. I'm just going to reach in and so you can see it transfer all, so we know now where all the bony structures are. There's a lot of forgiveness in where those marks are. Typically